6 key nutrients to support bone health. Bones play many roles in the body, such as providing structure, protecting organs, anchoring muscles, and storing calcium. While it's important to build strong and healthy bones during childhood and adolescence, you can take steps during adulthood to protect your bone health. Your bones are continuously changing. New bone is made and old bone is broken down. When you're young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. Most people reach their peak bone mass around age 30. After that, bone remodeling continues, but you lose slightly more bone mass than you gain. How likely you are to develop osteoporosis. This is a condition that causes bones to become weak and brittle. Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone to break, fracture. The most common injuries in people with osteoporosis are broken wrist, broken hip. What affects bone health? A number of factors can affect bone health. For example, the amount of calcium in your diet. A diet low in calcium contributes to diminished bone density, early bone loss, and an increased risk of fractures. Second, physical activity. People who are physically inactive have a higher risk of osteoporosis than do their more active counterparts. Third, the use of tobacco and alcohol. Research suggests that tobacco use contributes to weak bones. Similarly, regularly having more than 1 alcoholic drink a day for women or 2 alcoholic drinks a day for men may increase the risk of osteoporosis. Fourth, gender. You're at greater risk of osteoporosis if you're a woman, because women have less bone tissue than do men. 5. Size. You're at risk if you're extremely thin, with a body mass index of 19 or less, or have a small body frame because you might have less bone mass to draw from as you age. 6. Age. Your bones become thinner and weaker as you age. 7. Hormone levels. Too much thyroid hormone can cause bone loss. In women, bone loss increases dramatically at menopause due to dropping estrogen levels. Prolonged absence of menstruation, amenorrhea, before menopause also increases the risk of osteoporosis. In men, low testosterone levels can cause a loss of bone mass. 8. Eating disorders and other conditions. Severely restricting food intake and being underweight weakens bone in both men and women. In addition, weight loss surgery and conditions such as celiac disease can affect your body's ability to absorb calcium. 9. Certain medications. Long-term use of some medications is damaging to the bone and might increase the risk of osteoporosis. 6 nutrients your body needs to support bone health. One. Calcium. Taking calcium reduces bone loss and decreases the risk of fracturing the vertebrae, the bones that surround the spinal cord. Consuming calcium during childhood can lead to higher bone mass in adulthood. This increase in bone density can reduce the risk of fractures later in life. Calcium may also have benefits in other body systems by reducing blood pressure and cholesterol levels. More so, calcium supplements may help prevent tooth loss in older adults. The body is able to absorb calcium contained in supplements as well as from dietary sources. If it is not possible to get enough calcium from dietary sources, consult with a health expert for the best recommendation of the supplement to take. Two. Vitamin D. It aids in calcium breakdown and absorption. Vitamin D decreases bone loss and lowers the risk of fracture, especially in older men and women. Along with calcium, vitamin D also helps to prevent and treat osteoporosis. To absorb calcium efficiently, an adequate amount of vitamin D must be present. Good sources of vitamin D include oily fish, such as salmon, trout, whitefish and tuna. Recommendations for vitamin D supplementation may be different in people with certain underlying medical conditions. Three. Magnesium. While most research has focused on the role of calcium in bone health, magnesium is also essential for healthy bone formation. Research from 2013 has linked adequate magnesium intake with higher bone density, improved bone crystal formation, and a lower risk of osteoporosis in females after menopause. Magnesium may improve bone health both directly and indirectly, as it helps to regulate calcium and vitamin D levels, which are two other nutrients vital for bone health. 4. Zinc. It is an essential mineral that is required for normal skeletal growth and bone homeostasis. Furthermore, zinc appears to be able to promote bone regeneration. Dietary zinc deficiency has been linked to impaired skeletal development and bone growth. Zinc deficiency could be restored by addition of zinc into the diet or by taking a zinc supplement. 5. Vitamin K2. The activity of vitamin K2 involves both an increase in the bone building process and a separate decrease in the bone loss process. Vitamin K2 exerts a more powerful influence on bone than vitamin K1, and should be considered for prevention or treatment in those conditions known to contribute to osteoporosis. Development and maintenance of skeletal health is essential since the resultant effect of poor bone health is an increased risk of osteoporotic fracture. Six. Copper. Moderate serum copper levels are critically important for bone health. Lower serum copper levels are significantly associated with decreased bone mineral density in the total femur and femoral neck. Copper deficiency may result in impaired bone and cholesterol metabolism and cardiovascular disorders. However, you need to consult with a health expert for the best recommendation of copper supplements. For best results with bone health, consult a health expert to get a supplement that incorporates all the 6 nutrients in their recommended levels. Spinfair Nutrition,